Well, let's return to Niger State, where the ongoing fight against banditry is having a devastating effect on education and access to healthcare. Our correspondent, Chenami Bami, has more on this.
This is what an ideal classroom should look like, where the environment inspires learning and the shapes and pictures on the wall makes learning easier and interesting. But it is quite the opposite for children schooling at the Central Primary School in Gwada. They have to share their classrooms with displaced persons here. Instead of pictures on the wall, there are mattresses and properties of displaced persons. These affect the psychology of the children. But for the IDPs, they have nowhere else to go.
A grim reality for the people that live here in this primary school compound. To my right, children are having their education, playing outside the classrooms. But to my left, displaced persons that are running from banditry attacks in their communities are taking refuge here. This morning, they've all gone out to work as laborers in people's farms far away from this place. It's a rainy season. They can't go back to their communities. Now they must work as laborers. By evening time, they will be back to continue the sad reality of living here.
It has really affected the teaching and learning in this school because we don't have much classes for teaching. We have about 25 classrooms. Let me say 14 are being occupied by the IDPs. So the classes that are supposed to be having like 4 arms, some that are supposed to have 2 arms, they are now managing 1. The classes are filled up.
A couple of months ago, the former Minister of Humanitarian Affairs, Beta Edu, visited this camp and donated these tents, one to serve as classroom for the children and the other as a primary healthcare center. The tent for the classroom has been brought down by the wind, and the one meant to be a clinic is empty without drugs. Bako Bala has been in this camp for over 5 years, and he says the healthcare is getting worse.
Before, we used to get drugs. It is no longer so now. There is no one that gives us drugs at all. No one even cared to come and see the tent that was provided till this moment.
Some of our IDP were enrolled in that tent that is there. So as the rain was over, the tent got full. So they have no place to study now.
We used to get drugs even before this tent was brought. Whenever we fall sick, we will go over there to get drugs. They even provided us with water, but now it is difficult. Even when you go to the hospital for women, when you are sick, they will give you prescriptions and you will have to go and get the drugs. But what if you don't have money?
The way we are now, if the healthcare workers are not sent here by the government, they will not even know we are sick, let alone give us drugs. We put in our efforts to get money to take our children and ourselves to the hospital.
Mary has been sick for the past 6 months. She is now recovering. We followed her to the primary healthcare referral center inside Gwada town, where she receives treatment. The hospital gives more attention to women and children.
We even have our personnel that do go there to render immunization services. And whenever they have any medical condition, if they are not feeling fine, they always assess the service here.
He also confirmed that the environment contributes to their poor health. We spoke with the permanent secretary at the Niger State Ministry of Humanitarian Affairs and Disaster Management, a newly formed ministry in the state in charge of issues related to internally displaced persons. She said the growing population of displaced persons is overwhelming.
It's a pathetic situation, but the government is not completely oblivious of their condition. Drugs, basic drugs like we call paracetamol maybe, and drugs for malaria have been taken there, but it's not sufficient. As it is now, we are working seriously with the Ministry of Health to raise a memo so that there will be an increase in the drugs that will be supplied to the IDPs. And as I did say again, the numbers are on the increase.
In other areas in Shiro Local Council, that is still a hotbed for banditry. The schools have been converted to military bases, and using schools as camping area for IDPs is now causing a major setback to education. Chenemi Bami, TVC News, Gwada.